Hi everyone, welcome back to my channel. My name is Melisa Rodriguez and I am a rising second year medical student. I can't believe I must say that this year has flown by. But yeah, I make videos about my lifestyle as a medical student, and also I give out some pre-med sometimes. So if you're interested in this kind of content, please make sure to subscribe to my channel and just stay tuned for more videos. In this video, I wanted to share exactly everything I learned during my second semester of medical school. So the second half of my first year, and I did similar video before after my first semester of medical school, and I really liked it. I think it's a good reflection. It's not a popular video, but it's kind of a video for myself to just recognize everything I did and everything I learned. I definitely don't have all the details in my head, like I definitely forgot some stuff, but this video just reminds me of the things that I have progressed through or gone through. And I know I haven't been posting a lot, and it's because I have been in my vacation since a month already, and I do not recognize myself. I have been just chilling, just doing nothing, and I have been doing some research on the side, but overall I wasn't productive at all this last month. But my type A personality has revamped again, and I made a plan for this month of July, which is the last month I will be in vacation. So I will be posting regularly every week, so stay tuned for more. So yeah, starting with this video, my second semester was divided in two parts: my neuroscience and behavior part, and then pathophysiology and therapeutics one part. So neuroscience and behavior consisted of everything that was neurology, the head, everything from here up in anatomy, everything. And then PT1, because we have different sessions now. When I go into second year, I will be going into PT2. So for PT1, we did the GI system, we did hematology, and the GI part included the liver, of course, and we also did nutrition, which was a very important part, nutrition and exercise. So I will just cover everything in the details that I have here. I usually keep a log of all the lectures that I have done, because that just helps me to see like how many passes I have been going through. So let's just start with the first things that we did, which was neuroanatomy. And with neuroanatomy, we studied the meninges, the vessels of the brain, the cortex, brainstem, and cerebellum. And then we moved on to study the cranial nerves in details. I remember that was a very difficult part. And then we studied neurohistology, which included all of the different nerve tissue under the microscope and all of that. Then we did receptor potential and peripheral nerve, which was kind of review from pre-med, and then we went back into neuroanatomy to study more in detail the brainstem and the hypothalamus. After that, we did also some kind of review things, neurophysiology and synaptic chemistry, synaptic transmission. This is why I recommend you to study a lot for your MCAT, because these things, some of the things in the MCAT do come back, and you want to have a good foundation in that before you're tested on. And then we did muscle physiology, which is also review from pre-med. And then going back to anatomy, gross anatomy, we studied the skull, we studied the eye, all of the different nerves, vessels in the eye. We studied the sensory systems, like all of the pathways, and also the motor systems, which included all of the pathways, like the spinothalamic pathway, for example. Then we went into the spinal cord and did some cases there, so to make sure that we were comfortable with all of the neuroanatomy that was taught. We studied the visual systems, which I'm sure I forgot a lot. We studied the cellular and cerebrovascular response to injury. We studied aphasia, the limbic system and emotions. We studied pathology of the central nervous system, vascular, and we studied the pathology of the central nervous system due to trauma, so like concussions, all of that. For gross anatomy, we went back and studied the face and the neck, all of the anatomy of the face and neck, which was really challenging. We studied the orbit and the eye. For all of this anatomy, we studied the temporal region and the ear, all of these vessels, and this is a very challenging part of the neuro block, but it was really interesting. And then we did study the oral, nasal, and pharyngeal anatomy. Okay, so going back to other topics that wasn't anatomy, we studied the cerebellum. We studied neurodevelopment and some of the defects that happen, for example, spina bifida and all of those. We studied congenital hydrocephalus and perinatal brain injuries. We studied brain rhythms, EEG physiology, and some of the sleep topics, like how do we study sleep. And we also studied the pharmacology of pain, neurodegeneration, headaches and migraines. I know this might be overwhelming or maybe a little bit boring, I don't know, but I just wanted to just go over everything we have gone through. Then we studied the larynx for anatomy. We studied errors in sphingolipid metabolism, and that's part of the neuro, because when there's problem in the sphingolipids, it results in neurological problems. We studied coma, and we studied also child and adolescent psychiatry. So in the neuro block, it included some psychiatry, but I'm almost done with the neuro block. So next, we studied the Parkinson's disease, central nervous system, peripheral nervous system tumors. So all of those different tumors that there is, I should probably review because there were a lot of them and very challenging. The physiology of hearing, we studied the physiology of the vestibular system, and then we went into some psychiatric topics like all the psychotic disorders, including schizophrenia. We studied psychopharmacology, anxiety disorders, personality disorders, eating disorders, so more pharmacology of the central nervous system. We studied a lot of the pharmacology that basically went with the disorders that we studied. We also did pharmacology of anesthesia and pharmacology of addiction, and also some central nervous system infection lectures. So that was everything for the neuro blog. So I know it was a lot, but it was one of my favorite blogs because it was the most challenging up to now, and I learned a lot, and I hope I retained a lot of that information. I will definitely come back to some of it this summer. I have a plan for studying in July. But now moving forward to the second part of the second semester, it was hematology. So the first topic that we covered was hematology, and it included intro to hematopoiesis, interpreting the test that test the hematologic system, and also hemoglobinopathies and hemolytic anemias. So those were the topics that we covered for hematology. Very dense lectures that I learned a lot about, and it's really important. I think we go back to hematology in PT3 again. But then we went into GI and started with the reviewing the GI structure, which we have studied. If you haven't watched my previous video about FBS, that was our first semester, we get like an overview of everything. But now here in the individualized system-based blocks, we go in detail. So what they started with was with a review of the GI structure and histology, and then they went into more difficult content that we haven't seen before, like the GI development and imaging of the upper GI. Then they covered childhood nutrition, which was a great lecture. Then went into teaching neurohumoral regulation of GI function, GI secretion and absorption, which is really important to know all of those details. If you studied for the MCAT, that's really good foundation for these two lectures. We studied the developmental and congenital diseases and went over the radiology correlates for each disease. We studied altered esophageal structure and function. We also studied endoscopy as a diagnostic tool. We went over gastric and peptic ulcer disease, esophageal and gastric neoplasia, so all of the tumors and cancer of the upper GI system. Upper GI pharmacology, of course, irritable bowel syndrome, inflammatory bowel disease pharmacology, and then secretory and osmotic diarrhea, differentiating between those. And we did a lot, mind you, when we're learning all about all of these things, we're also doing clinical experiences and simulations about these things. I remember doing a diarrhea simulation session that they gave us a case and we had to determine what could it be, and just ask questions, and it was just really useful. So yeah, along with all of these lectures, we also got some of the clinical aspect, and I learned a lot during my clinic days, as you maybe have seen in some of my vlogs. Okay, next we went over infectious diarrhea, celiac disease, vascular and diverticular disease, which is really important, colorectal cancer, bowel obstruction and ileus, constipation, and anal rectal disorders. So yeah, that was for my first exam. I'm gonna look into the other. Then in exam number 2, we moved on to more the liver and gallbladder diseases, and we started with the liver anatomy and organization, kind of like a review, like I said, of FBS the first semester. Then we went into the imaging of the liver, gallbladder, and pancreas. We studied the gallbladder and the biliary diseases, which are really interesting, by the way. We studied bilirubin metabolism and jaundice, like what can you tell from jaundice, and what do you do, how to assess patients with jaundice. We studied acute and chronic pancreatitis, the pancreas and biliary pathology. All of the pathology lectures I loved, they were so interesting. Then we studied hepatitis A, B, C. We studied acute liver failure. We studied immunological basis of the liver disease. Then we went into pathology of the liver specifically. Really interesting lectures. I love those. I love the pathology lectures. We studied the clinical manifestation of portal hypertension, and then we took a break, and we didn't take a break, but we switched to some more different topics like human aging, physical deconditioning, and physical activity. We went over energy expenditure and body composition. We talked about obesity, physical activity, and weight control, how to manage. And then physical activity and type 2 diabetes. We learned about diabetes a lot. Our last 3 lectures, we went into nutrients, like vitamins and minerals, macronutrients and micronutrients. And then we went into some GI tract disorders and the nutritional implications of those. And lastly, this was an extra lecture or supplemental lecture, and we covered pancreatic cancer in detail, apart from what we have covered already in pathology. So yeah, that was everything that I learned in terms of lecture. This is not everything that I learned in terms of my whole medical school experience, because we did, like I said, have other supplemental curriculum apart from just the lectures that we received. But this overall is what I learned my second semester of medical school. I'm really glad that I got to share this with you. I hope you enjoy just learning about all the different topics we covered in our first year of medical school. So yeah, thank you so much for watching, and I'll see you in the next one.